Dear colleagues, dear organizers, dear presenters and participants, we are grateful for being invited to have a workshop with the title Reimagining Social Work Education in East Africa. My name is Christin Nilsen, and I'm a professor of sociology at the University of Agder in southern Norway. I'm also the project leader of Resilience, building resilient communities through inclusive education in East Africa. I'm here together with my colleagues, Charles Kalinganire from the University of Rwanda, Zena and William Manyama from the Institute of Social Work in Tanzania, Janestic Twikirize and Ochen from Makerere University, and my colleague Cecilie Revheim from the same university as me. At this workshop, we will present some preliminary findings from a research project we are currently undertaking, focusing on social work curricula. The overall question we ask here is to what extent the curricula can be said to be indigenous. We are aware that indigenization is a contested term. In our usage, it refers to how social work can be culturally relevant and respond to diverse local contexts. We argue, we understand indigenization not as a replacement of dominant colonial knowledge systems, but as a weaving together of different knowledge systems in order so that learners can come to understand, challenge, and develop knowledge at large. We approach our research question through a review of the curriculum of undergraduate programs in social work at our three East African universities, including also our Norwegian universities, for causes of comparison. We explore the curricula by looking in particular at the publications, with an attention to what language that is used, what type of publications that are incorporated in the curricula, where the authors come from, and, when feasible, the context of the empirical data that the publication rely on. In addition, we look at the gender of the authors, and we also include some contextual information about the respective social work programs. In this short video, we will present only preliminary findings. As this is work in progress, we welcome your questions and your comments after the video.
Hi, everybody. I'm Charles Kalinganire, lecturer at University of Rwanda. About social work in Rwanda, I'd like to tell you that it is a very young profession that was officially introduced for the first time as academic discipline in 1999 at the former National University of Rwanda. Initially set for 4 years, the social work program lasted 3 years since 2017, but the number of 480 credit to train generalist social workers is maintained. The curriculum prepared at the beginning was reviewed in 2007 and reshaped once again, respectively, in 2013 and 2017. The modules taught provide general knowledge and fundamental skills in year 1, while professional modules are particularly taught in year 2 and 3. The student benefit also from professional English in year 1 and 2. English is the main language of instruction. Relating to the teaching material, the books referred to are mostly Western literature based. Out of more than 200 physical documents in the library, only around 10% refer to Africa and Rwanda. These latter documents, I mean, concerning Africa and Rwanda, emerge from the researches conducted in the last 5 years, and they exhibit freshly the realities on the ground in the concerned countries. In addition, there are many electronic resources composed mainly of articles and book chapters, but very few refer to national or regional contexts. It's very important to note that most of the publications, more than 90%, are in English, and those appearing in French are mainly policy-oriented or concern social work allied disciplines. If not, they treat the subject in the interest of social work, like books dealing with history, conflict management, gender, governance, and particularly genocide against the Tutsi. As you can imagine, the high reference to Western models constitutes one of the big challenges we are faced with in the training of professionals capable to respond adequately to local problems. Of course, many other challenges can be considered, including the lack of enough permanent qualified social work lecturers and low representation of women. Here, in terms of gender mainstreaming, there is a need that men and women reshape their minds and become cognizant of the necessity to fulfill together and equitably the advanced social work roles in academia, be it in teaching, research, and publication domain. Furthermore, it's important for the bright future of the social work profession in Rwanda to well equip students as future practitioners and competent change agents with adequate theories, but theories fitting these with practice in different settings. Two, it's important to ensure that social work plays a developmental role and empowers all segments of the population, particularly the youth, so that they are involved sustainably in the problem-solving process. For success, we need to synthesize international Western theories with indigenous practices. I thank you very much.
Hello, my name is Janestic Twikirize, and I'm presenting findings from Makere University. We analyzed the curriculum document from 2015 to 2020. A bit about Makere University is that it's the oldest university in East Africa, having opened in 1922. In 1952 is when the first formal training for social work was launched, and it was at diploma level. The first degree program for social work opened at Makere University in 1969. Currently, there are about 19 universities that are offering a social work program, and in 2020 is when Makere University launched the first training at master's level. A key milestone was in 2018 when the first ever national minimum standards and competency framework for social work training and education were approved by our government. A bit about the undergraduate program structure is that until last year, it was a 3-year program, but it was extended to 4 years currently, structured around 8 semesters. And the extension really was mostly to create more time for field practice education. The curriculum is reviewed and reaccredited after 5 years by the National Council for Higher Education. Each semester, students are expected to take 4 core and 1 elective courses. And fieldwork is mandatory and makes up about 40% of the total credits for graduation. And average enrollment currently is 120 students per year. Now, regarding reference materials, the most materials used are textbooks, followed by journal articles. And when it comes to who is authoring or who is writing these materials, North America and Europe make up the majority of the authors. So we are reliant mostly on materials from these countries. And when it comes to African authorship, we found only 9 countries represented in the current publications, with Uganda taking 68% of these publications. The language used is English in almost all the publications, and this is based on the fact that English is the language of instruction and the official language in Uganda. And an interesting finding was in terms of gender of authors and co-authors, where 72% of the authors are males. And this is against the backdrop of social work being mostly made up of female educators and female practitioners, at least at the global level. And then in terms of the local content, we found that majority of the publications obviously are drawing from their own context, and that means that just a few publications are based on content from Uganda, just 18%, that's what we found. And when it came to the period, the dates of these publications, we're interested in this to know how current, we are in terms of references and all that. And we found that majority of the publications in the current curriculum actually were published between 2000 and 2020, which is the last 20 years. But our concern and our point of reflection is, the last 10 years are not necessarily having the highest representation in the current curriculum, and yet a lot has been going on. We are fully aware that individual lecturers actually update their teaching materials and references, but these are not being documented, which is an area that needs to be improved. So in short, we are pursuing indigenization and decolonization, but we are not documenting adequately. And if it's not written, it's been said, it doesn't exist. So this is a challenge to us as Ugandans, as academics from Uganda, to reflect on our materials and actually improve. Thank you so much.
Hello, participants to this presentation. I am Zena from the Institute of Social Work, and I would like to join others to make a presentation of overview of the social work curriculum of the Institute of Social Work in Tanzania. I would like to begin by saying that our institute is a public higher learning institution, which is the institute that first began to offer social work in the country in the year 1974. And the first program that was offered was the ordinary diploma in social work. Then in the year 1977, we offered an advanced diploma in social work. In 2002, we had initiated a postgraduate diploma in social work. And bachelor's degree program was officially accredited and began to be offered in our institute in the year 2006. And in the year 2007, we also initiated the accredited ordinary diploma and certificate courses in social work. And a bigger milestone was achieved in the year 2014 when we initiated the course of master's degree in social work. And all these changes were necessitated by the need to meet professional demands as well as educational quality standards. Now, with regards to the bachelor degree program itself at the Institute of Social Work, this program is a 3 years course, basically a generalist one, and it is organized in 2 semesters per year. So in total, we have 6 semesters, and each semester covers a minimum of 5 and maximum of 7 modules. The modules are categorized in core courses, fundamental courses, and elective courses. The curriculum of bachelor degree of social work at the Institute of Social Work is always reviewed after every 5 years. However, sometimes mid-review is being done as need arises. Now, to echo what my colleague have just said, Tanzania conducted a review of its literature in order to inform indigenization of the program in Tanzania, and a total of 315 books were reviewed. And findings of the review indicate the following. One, that types of the publications include books, articles, and others. And books constitute 67.6%, whereas articles 17.5% and others covered 17.7%. And these others included acts, conventions, laws, policies, manuals, handbooks, guidelines, and reports, both published and non-published. With regards to the years of publication, the findings show that our books, most of the literature that we use was published from the year 1990 to year 2019. In terms of language, despite the fact that Tanzania uses two languages, Swahili is a mother tongue, is a national language, and English as a business language, our findings show that the overwhelming majority of the books, 99.7% are written in English language. So Swahili does not inform much of our training and literature at the Institute. With regards to gender of the authors, findings show that our literature is predominated by male authors by 66.03%, whereas female constitute less than 20%, and others that include international and national writers constitute only 15%. With regards to authors' nationality, our findings show that if combined, the British and American constitute the majority of our authors as well as others, whereas nationally, the authors of the nation constitute only 27%. Also, co-authors are significantly represented by the American and the British, and Tanzania follow by only 20%. With regards to gender of co-authors also, our findings show that male predominate the co-authors of our literature. And with regards to issues that have been addressed by the literature that we refer to, the majority of the literature that we refer to is of international nature, whereas the national literature constitute only 25%. Thank you for listening, and that marks the end of my presentation. Thank you.
Hi, my name is Cecilie Revheim. I'm an associate professor in social work at University of Agder in Norway. Norwegians are a small and increasingly older population, and University of Agder is situated at the very south of Norway. We have 13,000 students in gender balance in favor of the females. Current situation in Norway now is that more women than men take higher education. In social work, more than 80% of our students are women. We enroll 70 to 80 students each year, and we've had this program for 30 years. 11 universities and university colleges offer social work education in Norway, and it's a practically and theoretically oriented 3-year bachelor degree, equal to 180 credits. And the program is regulated in the framework plan for social work education from the Ministry of Education and Research in Norway. Under this ministry, we have an independent expert body, NOKUT, responsible for accredit and monitor the social work education according to national standards. There are various laws and regulations that have a distinct impact on how we teach and structure our program, like the Norwegian qualification framework for lifelong learning. We have national guidelines and academic regulations for social work, and there are very specific learning objectives according to the current law and regulations. This means that there are national standards for the total competency achieved at the end of a bachelor degree. This is to certify and prepare students for work in different areas of the Norwegian welfare system. In 2020, we had a new national guidelines for social work education implemented in Norway. That means that we have restructured our program to deliver a curriculum that meets the academic theoretical claims. The education focus on basic elements of social work and methods, including work with individuals and families, groups and community work, communication skills and interaction, professional ethics, and primary discipline subjects such as social policy, sociology, psychology, and legal topics. The curriculum that we present here are data from 225 different publications. The students also need to read 1,200 pages of self-elected literature related to theses and papers on subject on their own choice, but these are not included in this presentation. We see that there are book chapters, books that dominate our reading lists. We have more and more articles. Also, public reports and documents, laws and conventions are a part of the curriculum. As you can see here, the gray color, it's non-gender publications. Social work as an academic discipline is dominated by female authors in Norway. There are also publications with both genders. When we look at the year of the publication, we see that most is from the reading list is after 2010. We evaluate the curriculum every year, and the last 5 years, a lot of our textbooks have been edited according to new changes in the society and the welfare system. Most of the publications before 1999 is actually laws and conventions. Almost all the textbooks are written in Norwegian, in a Norwegian context. But that does not mean that it is based all on Norwegian empirical data or Norwegian research. Western traditional theories and international research are translated, implemented, and discussed in a Norwegian framework within the Norwegian society and welfare system. The author's nationality are mostly Norwegian. We have one course taught in English, and there are authors from various European and Nordic countries. We also have one from Tanzania. For the future, our university aims to teach more in English and more international social work, also to enhance the exchange of students and staffs. Thank you.
Hello, thank you very much. Awich Ochen is my name. I'm from the Ugandan Building Resilient Community Through Inclusive Education in Eastern Africa, part of the project in Uganda. And I've been asked to give a small talk on the emerging issues from our presentations that my colleagues from University of Agder, my colleagues from the University of, from Makere University here, my colleague from the University of Rwanda, and my colleagues from the Institute of Social Work in Tanzania presented earlier on this reimagining social work education in Eastern Africa. The findings from the curriculum review project is very startling. It shows that African universities, especially within East Africa, relies heavily on literature and materials developed among Western universities or countries. We see the Southern universities depending so heavily on the West for scholarships. Western academics do use a lot of their own materials in teaching and instructions, but we, the African academics, tend to rely a lot on them instead of also using our own materials. I'm not trying to say that materials that are developed in the West are bad, but what we are trying to say is we need to make sure that we also take our place in scholarship. We also take our place in knowledge generation. We also take our place in knowledge building within these fields of social work. Because if we don't, then chances are that most of the things we teach, even the examples we actually give, do not bear any striking resemblance to some of the local realities that we face in Africa. Within East Africa regions, we see few indigenous scholars contributing to the research and publication in the region compared to all the publication and research outputs from the region. In other words, what we are trying to say is that the dominant publication about East Africa social work, East Africa development practice, and other related fields that social work borrows from in sociology, in political science, other aspects of social administration, in psychology, in public health, tend to be dominated by Western academics. We also see fewer women contributed to the scholarship within the region compared to the male. So what we're trying to say here is that in addition to already there being very few local scholarships, among these, when you engender them, we'll see that the majority are actually men, with very few female academics making contribution. Moreover, a lot that has been written on East Africa, as already indicated, are predominated by Western scholars, which further minimize opportunities for integration of local interpretations. In other words, much as Western academics can write about the situation in Africa, or the situation in East Africa, or the situation in Uganda, or the situation in Tanzania, or the situation in Kenya, or the situation in Rwanda. What we are trying to say here is that many of these actually might lack or might miss a very important nuance, that if they had a local person on the team who is working at the level of producing this scholarship, not only as a research assistant, but as a co-creator of the knowledge, as a member of the research team, as a co-investigator, then there are chances that some other local interpretation would be important. There are cases where people have gone ahead and actually made some mistakes about what they interpreted, and such position and situation are presented as facts about Africa, when in reality, they are not. So to continue with the major implications of our findings from this curriculum review project, we note that some of the materials that we use and the theories we extrapolate in trying to make sense of research experience and also explaining local and indigenous experience of life, as I indicated earlier, are heavily influenced by materials developed in the West. The limited utilization of information and materials for research, including analytical frameworks developed in the South or through collaborative ventures, significantly constrain African academics' efforts at not only decolonizing, but indigenization of the curriculum. As a result, we continue to offer social work education that falls well below the community and regional expectations, oftentimes producing graduates who are not able to make locally nuanced and directed practice decisions or even tackle indigenous social issues adequately. The limited utilization of Southern scholarships further undermines efforts at tapping local knowledge, local approaches, and development strategies, which can potentially reduce the cost of delivering development, or fully appreciating the rich milieu of African, indigenous, and cultural experiences into development of social work practice. The major conclusions we draw from all this is that so little has been researched and shared about indigenous social work practice and its potential to inform global social work practice. Significant opportunities for collaboration and networking, therefore, still exist in this area. And it is important that we take it up by working together with our partners in the West, especially those who value the indigenization and the decolonization agenda in trying to tap into this new knowledge, in trying to tap into the rich milieu of the African experience, which might not perhaps be informing current social work scholarship and practice. The finding, therefore, calls for more effort at African academics appreciating their rich and unique social work potentials, financing more research, focusing on indigenous social work, and also building more networks with local institutions that oftentimes derive the evidence base or use information from universities and research institutions to inform their practice. It should be noted that effective and more relevant and impactful interventions that transform social well-being are a function of local contextual realities that builds knowledge from the ground, and with it, the centrality of evidence-based practice. We are trying to say that evidence-based practice is at the center of everything. If we are going to do any reasonable programming, and that's going to make sense, and that is also going to be accepted by the people for whom they are intended. We would also appreciate the African unique situation and social cultural nuances being embedded as part of the curriculum to make social work education more relevant and appreciated locally and regionally. All this, however, do not happen in a vacuum, something that African academic needs to put critical emphasis on and expand their participation and contribution to scholarship. Thank you very much for listening to me.